We begin with a dire warning about COVID-19 in Canada and the pressure facing hospitals across this country. Right now, more than 3,100 people are in hospital with the virus. At least 1,000 of them are in intensive care, the highest tally at any point during the pandemic. The situation especially bad in Ontario, where ICU capacity is being stretched to the limit and trained staff are in short supply. Emergency physicians are among those ringing the alarm, and some are even calling on the federal government to step in.
What is essential for the next 4 to 6 weeks for us to get through this? I mean, the healthcare system is literally on the verge of collapse.
Thankfully, we are not seeing deaths spike like we did in prior waves, but that requires a lot of resources, a lot of care, and a lot of people and a lot of beds.
The federal government needs to get involved to help coordinate the transfer of healthcare worker resources from less affected provinces to more affected provinces, especially Ontario.
To get her perspective, let's bring in Melanie Gauthier. She is the president and director of the Eastern Region of the Canadian Association of Critical Care Nurses. She's also a critical care nurse at the Royal Victoria Hospital at McGill University Health Centre. Melanie, thank you so much for joining us.
Thank you for inviting me.
We heard Dr. Michael Warner there calling for a transfer of healthcare workers, including ICU nurses, from other parts of the country to Ontario. What do you make of that proposal?
It's an interesting proposal for sure. I think that one of the main things that we have to understand is that critical care nurses across the country are actually trained quite differently. As much as our job is fairly similar, the populations we care for can be different, and every province is quite different when it comes to their critical care training. So a critical care nurse from BC may not be the same from a critical care nurse from Ontario. So there are a lot of logistical challenges, licensing, regulatory challenges that could come up with that proposal. Not saying that it's not possible. However, there's a lot of different aspects to it that we would have to consider.
And just so we understand how it works, because there are, of course, so many specialized areas of nursing, what in particular is it about the training for ICU duties that are different, say, from other forms of nursing?
Yeah, so critical care nurses really care for the most vulnerable populations. They take care of patients that have life-threatening illnesses. And so they do have specialized knowledge. They do have advanced problem-solving skills. And their training is quite a bit longer than many other specialties. It does vary widely across the country. Some provinces require around a 6-month course, so theory followed by some bedside training with a paired nurse. Whereas other areas in the country, we're looking more around 2 months of theory training, followed by a month at the bedside. And that bedside training that you have is actually very dependent on the unit that you're working with and the population that you're going to be working with. So even within one province, a critical care trained nurse in a trauma critical care, for example, will have different knowledge and expertise than a critical care nurse that works in a cardiac intensive care.
A lot of those nurses right across the country now, of course, dealing with COVID patients. What are you hearing from your colleagues about how they're coping?
They're feeling quite stretched. They're feeling quite exhausted as well. I think that they've been in this for quite some time, and so as much as there's a lot of strategies that have been implemented to try and support these nurses, the responsibility of those patients really do fall on those nurses. So when they're caring for someone, I mean, sometimes their life is in their hands. And so there is a lot of responsibility that they're feeling to taking care of these patients, and it is taking a toll on them. They are somewhat feeling overburdened, and with some of the help that's being brought in, either nurses maybe from other areas to help support them, they still really hold on to that responsibility of the patient and the life and the safe care of these patients. So it is quite overwhelming for them, and they are getting quite exhausted. And I think that a lot of them are starting to experience, or probably even starting in the first wave, experiencing some psychological distress related to that, and also just physical exhaustion.
We have certainly heard from a lot of epidemiologists throughout this pandemic. We've heard from a lot of frontline doctors, but I think it's fair to say we haven't heard from that many nurses. So here's an opportunity. Help us understand what nurses on the front lines of this pandemic need.
I think what they need, I mean, recognition for sure is one thing, although that that might not help them at the moment. Currently, they need the resources for sure, the additional support. I think they also need time to just not relax. I can't say relax, but they need time for themselves. I think there is so much demand on them. And they need some way to rejuvenate themselves. And they also need ongoing support. And they need the public essentially to really respect public health guidelines. I think it is quite discouraging for some nurses to see large gatherings in parks and things like that, especially with nicer weather. I think it is quite difficult as a critical care nurse to see the public not necessarily take public health guidelines seriously. I think that would actually probably be the biggest thing.
Nurses are, of course, professionals. They go into the profession to help people and to save lives. But I get the sense in hearing you talk about the toll. Are you worried that there could be long-term effects, not only on nurses personally, but on the whole system, about those who may choose to leave or to move on because of their experience through COVID?
Yes, and we've actually had a lot of these discussions that we do fear that quite a lot of critical care nurses will be leaving the profession, or at least the specialty, just from the psychological distress that they have been experiencing. There is even some nurses are experiencing, symptoms of PTSD, so post-traumatic stress disorder, and so we are concerned that there will be quite a few nurses leaving at the end of this pandemic, and I think a lot of them have actually left during the pandemic, frankly, just because of the emotional toll and the physical exhaustion related to it. So this is something that is excessively worrisome, and it does take, as I said, up to 6 months to train a critical care nurse. And so if we do see that exodus of nurses, we are concerned of how well we can supply, knowledgeable critical care nurses and skilled critical care nurses back into the system after this pandemic.
Melanie, I want to thank you for your time and your explanation of a factor in the healthcare sector that probably doesn't get enough attention. I really appreciate it.
Not a problem. Thank you so much.
Critical care nurse Melanie Gauthier. She's also the president and director of the Eastern Region of the Canadian Association of Critical Care Nurses.